Hi, I'm TJ Chambers, ADHD Smart Guy from ADHDawareness.com, and I talk to you about the symptoms of ADHD. And the symptoms of ADHD are used by doctors to diagnose ADHD, and they have a diagnostic manual, the DSM-IV, that has a list of symptoms that they use to determine if someone has ADHD or not. Now, I have another video about the causes of ADHD, and I go into that, and it'd be beneficial for you to take a look at that one also to learn more about what is causing these symptoms to be so bad that people need to be put on medication. Now, here are some specific examples of things that people do, or people that have ADHD do, and I have a total of 71 on my website on the assessment checklist part of my website, and you can go there and you can view the 71 different examples, and I'm not going to read all of them, but let me read a few of them to you. And these are things that you may find that yourself you do, or your friend, or maybe your child. Makes careless mistakes in schoolwork, has tendency to embarrass others, lies or steals on impulse, has trouble maintaining an organized work or living area, is often late, procrastinates especially with multifaceted tasks, is easily overwhelmed by everyday tasks, has trouble getting started, starts projects but does not finish them, fails to finish schoolwork or chores, is inconsistent with school performance, spends excessive time on homework, has a tendency to drift away, has problems with self-esteem, has a negative attitude, has trouble maintaining friendships, acts immature for age, has trouble expressing thoughts and feelings, is verbally or physically abusive, avoids group activities or organized sports, has a quick temper, is short-fused, has rage outbursts, gets upset by minor annoyances, is argumentative, worries needlessly or excessively, has tendency towards obsessive behavior, turns words around in conversations, performs poorly under pressure, has difficulty reading unless very interested in the subject, has difficulty falling asleep, has difficulty waking up or feeling fully awake, is frequently tired. So that's just a few of the symptoms, specific symptoms of ADHD. And there are two categories of ADHD, actually three. Category one is a person that has inattention problems. Category two, they have problems with hyperactivity and impulsivity. And category three is the combined type. That means they have problems with all of them. Now this is what the doctors use, and it's right out of the DSM manual. And for inattention, section 1, you should have at least 6 or more of these symptoms in each of the sections, and should be seen for at least 6 months. Number 1 is often does not give close attention to detail or makes careless mistakes in schoolwork, work, or other activities. Often has trouble keeping attention on task or play activities. Often does not seem to listen when spoken to directly. Often does not follow instructions and fails to finish schoolwork, chores, or duties in the workplace. Often has trouble organizing activities. Often avoids, dislikes, or doesn't want to do things that take a lot of mental effort for a long period of time, such as schoolwork or homework. Often loses things needed for tasks and activities, toys, school assignments, pencils, books, or tools. Is often easily distracted, is often forgetful in daily activities. Now for section 2, that's hyperactivity and impulsivity. Often fidgets with hands or feet or squirms in seat. often gets up from seat when remaining in seat is expected, often runs about or climbs when and where it is not appropriate, and adolescents or adults may feel very restless, often has trouble playing or enjoying leisure activities quietly, is often on the go or often acts as if driven by a motor, often talks excessively. So that's hyperactivity, and this is impulsivity. Often blurts out answers before questions have been finished, often has trouble waiting one's turn, often interrupts or intrudes on others. So that's the basis for the symptoms of ADHD. If you're looking to see if someone may have ADHD, now this tool is not to diagnose anyone, but if you visit my website and check out the assessment checklist, it has 70 questions and more than 20 checked yes indicates that there's a tendency towards ADHD, and that's free. You can use that and you can print it off if you plan on going to a doctor, and print it off and you can take it with you, because normally what they do is they give you this same kind of checklist to fill out, and if this is exactly the same thing, then you won't have to fill out the checklist while you're waiting, or maybe you're visiting your medical doctor. You can just take it with them and see what they think. And so feel free to leave any comments or any questions on my website, and I will do my best to answer your questions.